Arthropods, I think I'm going to start with next. We've got fair bit of material, so I want to go ahead and get started with this and cover it. Again, textbook may not be your best source on this particular topic. If you look at your textbook, you'll see that it is kind of diffuse and very superficial in its treatment of all of the arthropods. So it's just a very small, typical overview of the complexity, and I'm not going to talk about all that many of them. I'm going to totally ignore ticks, which are important vectors, especially for a lot of the different rickettsial and Rocky Mountain spotted fever, things like that, things that are not pertinent to what I'm talking about, but you'll probably cover those vectors with their particular disease processes when you talk about them. There are also some good resources available from the military for like tick identification. And there are several of those that you should be aware of. But again, I'm not going to talk about the ticks per se today. Typically, a lot of times you don't get to actually see the tick. By the time they come in with a disease process, they've already removed it anyway. But another site, this tropical diseases site here at the bottom, is also, I've thrown it in on the arthropods, but it really is a good overview of all the parasite problems I've talked about. So if you want kind of a good synopsis, and they talk about some of the imaging. Unfortunately, they don't have any good pictures, but they describe in detail the clinical presentation and radiographic appearance of a lot of these disease processes. So it's a good resource to go through if you wanted to skim over things too. We just covered myiasis a little bit. This is a list of the more common species that we worry about. Cochleomyia and Chrysoma are the New World and Old World screwworms, respectively. Screwworms are historically very important because they actually will lay eggs and they will destroy tissue. Most of your fly larvae, especially like your common housefly, they may get into a wound and they may have maggots that they deposit into the wound. But in general, those maggots are not going to be invasive. They're going to eat the necrotic tissue that's associated with the wound debris that's formed from tissue death. But they're not going to invade and further penetrate into the animal or the human. However, the screwworm is one of those species that actually does cause serious invasion and degradation of tissue. Historically, you're not going to, again, I say it's historical because we've had in the U.S. An eradication program where they actually released sterilized male flies, and so they've totally eliminated it from the United States and Mexico for the most part. There still is an incidence in South America. There's the potential for reintroduction of these worms, but you're unlikely to see them in the United States. Calliphora, Oestris, Sarcophaga, and Gastrophilus are different species of bots that are maggots that actually do infect, and there's a few others as well. Again, if you search, like I think I told you yesterday, search ABC News and bikini and worms, parasites, you'll come across a case report where they talk about an African fly that deposited its eggs on a wet bikini, and a lot of these flies will lay their eggs on brightly colored moist cloth, and it can serve as a reservoir for introducing the eggs and larvae into the human host. But most of these cases you're going to come across, it's not necessarily unobvious what they are, especially if you've seen such a nice video. Fairly straightforward. They are distributed worldwide, and they're more typical they can be in either healthy or necrotic tissue. Frequently, the larvae are laid in a wound. So one of the important things to do is to properly dress and cover open wounds so that they are not actually infected. These grubs have mandibular hooks that allow them to proteolytic digest tissue. They can have a gastrointestinal or urinary involvement occasionally. The screwworm distribution, you can see why they talk about it. New World would be the United States and South America, whereas Chrysoma species will be in Africa and the Mediterranean areas and a good bit of the Asian continent. These are representative grubs here on the left. And again, these are clinically relevant. This is a particular case with a woman who had necrotic adenocarcinoma. So she actually had an open lesion, and the infestation that resulted was because of the wound wasn't properly dressed, and it allowed deposition of these fly larvae into this existing lesion. So, this lesion has to do with her cancer, not with the caused by the myiasis. But that's an opportunity for these flies to deposit their eggs and produce these infestations. And I can tell you that there's not much that'll make you crawl. It'll make your stomach turn over when you've got a wound that's full of these maggots, and they're just moving around, and it's kind of a wiggling, occlusive mass. It's very gross. Obviously, what you need to do in these cases is do extensive debridement and flush the wounds. You can actually use some type of permethrin or insecticide in the flush to actually kill any of the existing maggots that are still present. And secondary bacterial complications are a very common secondary problem associated with these lesions. So hygiene, avoid flies, debridement of wounds if they are presented. If you have a bacterial component, antibiotics will be an essential part of it, but the antibiotics are not essential for the myiasis themselves. The other type of presentation would be, the biting flies or mosquitoes where bot eggs are deposited. These actually will be lumps or bumps that grow up. And what I want to caution you against is, this is showing somebody who's sitting there squeezing like they're trying to express an abscess. That's a little bit dangerous. And because these worms, just like any of the others, are very antigenic. If you kill them or you rupture that worm and release everything in there, you better flush out that cavity very well, or you're going to have a very acute inflammatory reaction to the worm antigens, and it can be very painful. So the best approach is to use a film of petroleum jelly. Petroleum gauze, is like was shown in the video, is good. Some places talk about actually putting down a piece of bacon to give the grub something to migrate into that's fatty to occlude the surface of the wound, and then bandaging over that. And then if the worm migrates up into there to be able to breathe, it's easier to extract them. Lice. 3 species of lice that we're worried about: Pediculus humanus capitis and P. humanus humanus. They're actually the head and body louse are very hard to distinguish. They're very closely related species. The distribution is what tells you the species more so. So your head lice is going to be on the hair in your head, capitis, whereas the body louse typically affects the body all over. Then Therius pubis is the crab louse. It's kind of gross, yeah. Anybody that'll tell you after you're dealing with patients that have either of these, you're going to feel like you've got things crawling on you, and you're going to want to go home and shower. Even in developed countries like the United States, head lice are fairly common infections that pop up in schools. You have all these different stages from the nit, which is the egg that's laid onto the hair. You have different nymph stages that they go through as they molt into the adults. This is just a sampling of lice that's present, or what they look like. They're going to be confined predominantly with the capitis to the head. And that's the ones you'll see probably more often in the United States. The adult lice actually, it's interesting. We actually had a horse come in one time that was just loaded with probably several thousand. And they move in waves. They would come to the surface and then they would disappear back and forth. Very gross. It's typically going to be in crowded environments. Again, schools are a good place for transmission. We've got better ways of treating it, so I don't think it's nearly as common today as maybe it was 20, 30 years ago. But when we moved here, that was my neighbor 3 houses down. That was the first thing she said. Love to meet you, but don't come. We've got head lice. So it was really a good greeting. Moderate to severe itching can produce fever, secondary infections. These actually do feed on the scalp and blood. They're not, the hair is what you have to comb the nits out of. And I left this in there. This is the old school treatment. Quell. Anybody ever seen Quell? It's a benzene hexachloride. And I have it in 2 different places. When we talk about crabs, I have Lindane as an alternative treatment. This is Lindane. Lindane is an organophosphate. It's fairly toxic. And not too long ago, this was the primary choice of how you treated it. You did an initial treatment, and then you came back and did it later on. It is fairly toxic, though, so it's nice that this has gone by the wayside. Your current drugs of choice are going to be either a malathion or permethrin or pyrethrins with different components. You can use ivermectin. Is ivermectin going to work by spraying it on? Yes, no. Ivermectin you typically give, and then they eat that as part of their blood meal, and then it will kill them. So that's a more chronic therapy for killing the adults. It's not going to be something that's instantaneous and like a spray on like you do. So typically it's not going to be what you use. Should not use this for eyelashes. And that's just a footnote here, number 1. And that's a note too. The crabs that you see on eyelashes will typically be in young children, and it's an indication of sexual predation. And it is a reportable offense. You need to call in Children's Services. Body lice. This is a courtesy of the armed forces. Again, they have some really nice pictures from the people they deal with. But you can see that in a large infestation, it produces a severe dermatitis. So it would be very pruritic and itchy. They're typically in the clothes. If you have somebody that's living on the street that comes in, you want to burn probably the clothes to get rid of the source of the lice, or where they're going to stay. Body lice, unlike head lice, are important in that they are a source of transmission for epidemic typhus, louse-borne relapsing fever, and trench fever. So they're the primary vectors for these three diseases. Typically associated with bad hygiene. So where you would see it in the United States, again, is somebody who's living in the streets, who's not changing their clothes, doesn't have access to a washer and dryer. Treatment is going to be similar to head lice, but again, you're going to also need then to treat the clothing and sources of potential recontamination. Therius pubis, commonly referred to as crabs, typically transmitted by sexual disease. They infest the coarse hair in the pubic area in adults. Again, if it's found on the head or eyelashes, there's a be indication of sexual exposure or abuse in children, and can be spread by personal contact or fomite transmission. Fomite is just a technical word for inanimate object. So sheets, combs, things like that. Again, the life cycle is essentially the same as what you would have for the head lice, and the treatments are very similar. The symptoms will consist of severe itching. They're fairly difficult to spot, but diagnosis is going to be based upon actually seeing the lice in the pubic area. 1% permethrin or a mousse containing the pyrethrin and piperonal oxide. So the mousse is basically going to just be kind of a foam that has these insecticides contained in it. Real easy to apply. Fairly straightforward. You can use Lindane or Quell in refractory cases. Probably not going to be that often that you have to worry about something like that. Y'all want to take a quick break since we're right at that time? I'll keep going right from there.